Hi, my name is Ellen, and I'm the Programs Coordinator at Arthritis Consumer Experts. Welcome back to Arthritis at Home, and today I am joined by Kelly Lendvoy, VP of Communications and Public Affairs at Arthritis Consumer Experts. You can see from previous episodes that Kelly and I have switched spots. Today I get to interview him about the poster that was presented at the Canadian Arthritis Research Conference. Welcome, Kelly.
Thank you, Ellen. Nice being here.
So Kelly, I would love if you could give a little bit of background on the poster itself that was presented and the Canadian Arthritis Research Conference, and how did this project kind of originate?
Yeah, maybe I'll give a little bit of background so people can understand how great of a community effort this was. And it's based on a lot of work that the Arthritis Alliance of Canada conducted over its 17-year history. It ended or dissolved in 2019, but the AAC, the Alliance, dedicated the majority of its time, and this is an alliance of clinicians, researchers, patients, really dedicated a lot of its time researching, developing, and documenting an inflammatory arthritis model of care. And by model of care, we mean a sort of standardized model of treatment and delivery of healthcare to, in this case, inflammatory arthritis patients across Canada. And even though arthritis is the most common long-term chronic disease, Ellen, there is no national strategy or national model of care that exists for inflammatory arthritis today, like it does for other diseases like cancer, heart and stroke, diabetes, and most recently mental health. Mm-hmm. So the way that inflammatory arthritis, people living with inflammatory arthritis access and receive healthcare varies across the country. And this can lead to, I think, some real frustration and disappointment for these patients who depend on some critical elements in a models of care, like getting a timely and accurate diagnosis. We know how important that is for inflammatory arthritis. Timely access to rheumatologists. Certainly if you live above the 49th parallel and you're in rural, remote regions in Canada, it can be very, very challenging to get access to a rheumatologist, as well as adequate reimbursement for arthritis medications, among other things. So when the Alliance wound down in 2019, they told the community that they had some money left and that they were going to disperse these remaining funds through a legacy grants competition. And ACE, our organization, led the development for a proposal that was in collaboration with 3 other patient groups and organizations in Canada, our peers. And they included the Arthritis Patient Advisory Board of Arthritis Research Canada, the Canadian Arthritis Patient Alliance, and the Canadian Spondylitis Association. So together we put together a proposal, and we were fortunate enough to be awarded one of the 5 legacy grants. And that's how this project got started.
That's awesome, Kelly. And like you said, the importance of consistency, right? Moving from province to province. To think that, you would receive different care is so strange, in a sense.
It can really depend on where you live in Canada in terms of the standards of care that you get. And that certainly goes against the principles of which this country's healthcare philosophy and system was based on.
Exactly. Really, really hard to imagine, almost as someone who's been lucky enough to receive extremely consistent care. Definitely, see the importance of the work that you're doing, and congratulations on winning one of the 5 legacy grants.
Yeah, and then I mean, then our work started, and
Hmm.
we had to figure out who we are going to meet with, what we were going to say, how we were going to present our message, our story, what kind of tools are we going to use, what kind of information we're going to use. And we started planning in late 2019, and we were intending to conduct a 5-province tour. We're going to visit 5 provinces, and we are going to visit in person with the people responsible for health policy in these 5 provinces. And then something happened, and that was the pandemic, and we had to shift our strategy and the way that we were going to deliver the message. Obviously, it wasn't realistic to be traveling anymore, so we converted the program into a virtual tour of the 5 provinces, and they included New Brunswick and Ontario and Manitoba, Saskatchewan, and British Columbia. And we decided to focus in on the work that the Alliance had done on IA, inflammatory arthritis models of care, and focus our message on identifying gaps in care, proposing some solutions to governments, and particularly solutions around virtual care and the expanded role of arthritis health professionals to improve the treatment and delivery of care in rural and remote and indigenous communities. And that was a message that was very much aligned with the provinces, not just the 5 that we were touring with, but all the other provinces in Canada and territories right now coming out of the pandemic are talking about and starting to put policies together to really transform the delivery of healthcare. There are all sorts of fiscal challenges and restraints that healthcare systems across the country are experiencing, and a pandemic deficit is one of them. So trying to be as efficient as possible with money, but to also identify that chronic disease rates continue to grow, the population is aging, and there's some real sort of serious issues that they're facing, and they're coming up with solutions, and we wanted to make sure that arthritis was at the table.
As it should be. And Kelly, can you share with us a little bit about the experience communicating with the policymakers and government officials? Did you run into any challenges, and how did you kind of navigate them?
Well, I think one of the ideas we had early on was it wasn't just going to be meeting with these policymakers and just have our patient organizations and the patient voice in the room. We felt it was really important not just to be able to tell the story about the lived experience, but to talk about it from a clinician or research perspective as well, a 1-2 punch, if you will.
Yeah.
And so what we did in the 5 provinces is we invited members from the research and clinical community, leaders in their provinces, to join us and be able to provide their perspectives as well. And I think that proved to be very, very powerful and compelling in the meetings that we had, centered again around these 2 areas of policy and public policy priorities for the arthritis community, and the first one being virtual care. So we talked to the policymakers about how important virtual care is, how much our community's experiences have been affected by it, not just during the pandemic, but over the last 10 to 12, 15 years almost. Mm-hmm. Our community were early users of telehealth, but it's not a panacea, it's not a cure-all. And we talked to them about some of the barriers that inflammatory arthritis patients have, particularly in the Black, person of color, and Indigenous peoples populations, or socioeconomic too, across the board. And that is barriers like the cost of the electronics that people need to use, the lack of digital education or literacy to understand how to use those devices when they're trying to access virtual care, the challenge of broadband delivery in rural remote regions, and just the simple barrier like language, what languages the virtual care is offered in, and are we really meeting the needs of all of our patients. So that was sort of the series of messages that we delivered when it related to virtual care. When it came to expanding the role of arthritis health professionals, we again tried to focus in on rural, remote, and Indigenous people's communities. We talked to them about the gaps in care in those communities and how important it was that that our community was fully understood, and that the people who were delivering the healthcare and arthritis models of care to patients in those communities, that it was delivered in a way that was culturally relevant, culturally appropriate. So we really focused on the Indigenous peoples. And certainly one of the things we spoke to them about was call to action number 22 from the Truth and Reconciliation Commission. And that is incorporating traditional healing practices and treatments in an inflammatory arthritis patient's treatment plan. So trying to raise awareness, trying to have a dialogue and a conversation to ensure that if we are going to improve the way we deliver care to patients in the north and the rural remote regions, arthritis health professionals can play a really important role, but it has to be done in a way that's, again, culturally sensitive and truly meets the needs of the patients.
Wow, it sounds like, there was a lot of thought and a lot of kind of understanding in the planning process of this initiative, where, you went not to have an agenda and tell, government officials, these are the things that we want, but, you brought a united front and you presented them with different perspectives, and you were able to then get the ball rolling, right? Like you said, have that dialogue, have that conversation. So, Kelly, I'm so excited to hear, what are some of the outcomes? What did you find? And yeah, I'm excited to learn more.
Well, we really were pleased with the level of engagement that that we achieved. So we launched the virtual tour during Arthritis Awareness Month in September of 2021, and then visited these provinces over the course of a 3-month period. And in BC, New Brunswick, Quebec, Ontario, Saskatchewan, and Manitoba, we met with representatives from the Ministry of Health, all the way from the top, from the minister's office to the health critics, and then to the different departments within the ministries of health, particularly those departments that were working on chronic disease management, on the integration of virtual care into the health system, and on rural, remote, and Indigenous people's care. So we had a series of meetings in each of those provinces with elected officials, with senior bureaucrats. All 4 of our patient organizations were at those meetings, along with our special guests from each of the provinces, the leaders from rheumatology. And I think overall, we met with a very positive reception. Like I said, this work is being done now. It's underway in each of these provinces. The transformation of healthcare is happening. And so it was a very timely opportunity for us to be getting into the door as they're doing their planning. And we're going to hear about the results of this planning and the implementation of these new policies probably in the second half of this year, coming out of the pandemic, and certainly forward into 2022 and 2023. We also conducted a lot of social media around the tour. And so all 4 of our organizations and other organizations from the arthritis community jumped on board. We made a lot of noise, but also government was firing back at us through their social media channels. And certainly that's a very effective way and another layer of engagement now when you're dealing with governments is to be doing work through social media. So those were sort of the concrete results. And I'm happy to report as well that we're going to have follow-up meetings with practically everyone that we've met. Wow. So we have a very busy agenda in 2022 following up on the meetings that we had last year.
The different levels of engagement is really a great way to think about it, and the fact that you were able to, target those different levels and make so much progress. Incredible work. Thank you so much, Kelly.
Just a huge shout out and thanks to our partners, our collaborators, and that is again the Patient Advisory Board from ARC, CAPA, and the CSA. It was very gratifying to be with those other leaders and working on this project.
Wonderful. And if our viewers want to learn a little bit more, we will link the poster beneath this video here. And if they want to get involved, Kelly, is there an opportunity to do so?
There is. Contact ACE, contact myself, contact Cheryl Cohen. We sort of lead the advocacy effort here, and always very interested in hearing feedback from members of the community. I think we'll also provide some links to the work that the Arthritis Alliance of Canada has conducted in this area of models of care. So if people want to access that, some of it is very patient-friendly, designed for patients. So we'll provide those links at the end as well.
Awesome. Thank you so much. And with that, thank you to our viewers for tuning in, and be loud, be proud, and keep making noise. Right, Kelly? That's the message?
Sounds great. Thanks, Ellen.
Awesome. Thank you, everyone. Bye.